So in the UK at the moment, about 100,000 people a year have a knee replacement. And that knee replacement usually happens to relieve pain and improve function, improve mobility. But about 1 in 5 of those people find that they have long-term pain after their knee replacement. And when we're thinking in research about what we mean by long-term pain after an operation, we're really thinking about pain that happens 3 and more months after the surgery itself. So some pain is to be expected after a knee replacement operation in the same way that you might expect some pain after any kind of surgery. But when that pain carries on and persists, then we think of that as long-term pain. We also call it chronic pain. It's the same word for different word for the same things. But pain that happens at 3 months and afterwards is something that we think is really important to understand and try to help with.